AQP4-IgG is a disease-specific autoantibody of neuromyelitis optica spectrum disorders. And as for the treatment, first, if we can prevent the onset of the disease, that would be wonderful. And we know that some patients become seropositive long before the onset of the disease. For example, more than 10 years before the onset. So if we can detect those patients prior to the development of the disease, then we may be able to do something to prevent the onset of the disease. But in our real world, it's not easy to identify such patients. For example, some patients with NMOSD may also have myasthenia gravis. And in a study done in Japan, 600 myasthenia gravis patients were searched for the presence of AQP4-IgG, but only 0.5% were positive. That means you need to test 200 myasthenia gravis patients to find one AQP4-IgG positive cases. Well, it may not be easy to find one, so that's the reality, unfortunately, at this point. And as for the acute exacerbation, needless to say, high-dose corticosteroid is the first-line treatment. But only up to 20% showed complete recovery. So we need to do something else as a rescue treatment. Plasma exchange, immunoadsorption, plasmapheresis, and in some countries, IVIG may also be available. But one important thing is the timing of the plasma exchange. One group reported that if the plasma exchange is started later than 5 days of attack onset, recovery rate becomes very low. So you have to start plasma exchange as soon as possible, probably as a part of first-line treatment in the acute attack of NMOSD. And as for the relapse prevention, as you all know, recently 3 monoclonal antibodies were formally evaluated in the first ever international randomized controlled trials, and all showed high efficacy, and safety profile is relatively good. So more and more patients may be treated with this new treatment as the first-line treatment, so from the beginning of the disease, or second or third line treatment after failure of the current immunosuppressive treatment. But one big issue of these new therapies is that they are relatively expensive. So we may need to do something to reduce the treatment costs of these treatment disorders for more patients to be treated with this treatment. And symptomatic treatment is also important. We usually focus on immunological treatment, but symptomatic treatments for neuropathic pain, tonic spasm, fatigue, depression, bladder problems are also important. So don't forget to provide symptomatic treatments to the patients. And there are some new approaches in the treatment options. For example, the stem cell transplantation is relatively new. And one study showed a very promising result, but in others, the results are very much complicated. One patient responded well, but the others did not respond. So more studies are needed. And another attractive treatment might be the immune tolerance. There are a number of different technologies are being developed to provide immune tolerance to patients with NMOSD. And the Guthrie-Jackson Charitable Foundation is planning to hold a symposium to discuss this issue early next year. So if you are interested, please visit the website for more information. So taken together, advances of the therapeutic for NMOSD patients, especially the AQP4-IgG-positive ones, are remarkable. But there are a number of challenges ahead. For example, in individual patients, which drug should be chosen first, there are a number of questions that we need to address. So we should work together to develop a better personalized medicine for this disease.